Hello, Miss Hearns.
Yes.
Hi, my name is Lisa. I'm
Hi,
an
Lisa.
advanced practice nurse, and I'll be doing your history today.
Okay.
How are you today?
I'm doing pretty good.
Okay. My name is Lisa. Like I said, I'm an advanced practice nurse. Are you familiar with the advanced practice nurse role?
No, I'm not.
Okay, so advanced practice nurses are registered nurses that have gone beyond the 4 years of a bachelor's degree.
Okay.
We can prescribe medications, we can make referrals, we see our own patients, and we can treat and diagnose illnesses.
Okay.
So does that help provide a little bit more understanding
Yes, it does.
of my role? Okay, great. And how are you doing today?
I'm doing pretty good.
Okay, and may I call you Caitlin?
Yeah, that's
Okay.
fine.
All right. So I just want to start. I want to ask you a few questions regarding your information. Can you tell me your full name and date of birth?
Sure. It's Caitlin Hearns and December 11th, 1987.
All right. And what's your address and phone number?
It's 22441 Imperial Drive in Richton Park, 60471.
Okay.
And phone number is 708-769-1372.
All right. And do you identify with being female?
Yes, I do.
Okay. And what race do you consider yourself?
African American.
All right. And do you have any children?
No, I don't.
Okay. And what's your usual source of health care?
Primary doctor.
Okay. When's the last time you saw your primary care doctor?
It was in March.
March of 2015.
Mhm.
Okay. And what brings you here today?
Just a yearly checkup.
Okay. Well, thanks for joining us. So I'll start with, since you've seen your doctor in March of 2015, how has your health been overall?
It's been about the same. Pretty
Okay,
good.
great. No hospitalizations or ER visits?
No.
Okay. Do you have any chronic illnesses?
Just asthma.
Asthma?
Mhm.
Okay. And when were you diagnosed with asthma?
About when I was 5 or 6.
Okay. Do you take anything for that?
I do. I use inhaler, the albuterol sulfate inhaler.
Albuterol sulfate inhaler. And about how often do you use it?
Just seasonally, whenever I kind of get a flare up or is needed, basically.
Okay, so maybe once or twice a year.
Mhm.
Okay. And what are your flare ups?
It's just like a cough that I'll get. That's about it. It's a sound I can tell. So.
Sound. Okay.
Mhm.
Do you have wheezing?
No.
Okay. Have you ever had to be hospitalized for asthma?
When I was little.
When you were little, do you
Mhm.
remember anything about the hospitalization?
Not really. It's like when I was 5 or 6, that's when I was diagnosed. I was hospitalized for asthma, and they diagnosed it then.
Okay.
So it's been
All
a
right.
while.
And it's been controlled
Yeah.
ever since?
Oh, yeah.
Okay, great. That's great. Do you have any mental health illnesses?
Mm-mm.
Things like depression or panic attacks?
No.
Okay. All right. And moving on to your immunizations, are you up to date on your immunizations, like the Tdap, flu shot? Okay.
Yeah.
So you received the Tdap, and when's the last time you had a booster?
Probably a couple years ago when I first started my job, it was required to have a physical and get checked out and get all that done. So.
Okay, great. So that one, the booster is usually every 10 years, so you're right on track with that.
Okay.
When is the last time you had a flu shot?
A week ago, I went to Walgreens to get it.
And you usually go to Walgreens?
Oh, yeah.
Okay, great. So you're right on track with that too. It's flu season. You usually go to Walgreens. Have you ever had the hepatitis B vaccine in your lifetime?
Yes, I have.
Okay. And that's the series of 3 shots.
Okay.
So, okay.
Yeah.
All right. Do you have any allergies?
No.
Okay. Any allergies to foods?
Walnuts and pecans.
And
just the itchy mouth, that's it.
Okay.
Nothing else.
Okay, you've never been hospitalized for
no.
that allergy, and no skin rashes or anything?
Nope.
Okay. Are you any allergies to medications?
No.
Latex?
No.
Medications, I'm sorry, like penicillin?
Oh, no.
Okay.
No.
Environmental or seasonal allergies?
No.
Okay. Any allergies to pets?
No.
And latex? I'm not sure if I asked
No.
that. Okay. And you've been hospitalized when you were 5 for asthma?
Mhm.
Any other hospitalizations?
Nope, that was it.
Okay. And have you ever been to the ER for anything?
No.
Okay. Great. Have you ever had any surgeries or procedures?
Not that I know of, no.
Okay. Great. I'm going to move on to injuries. Have you
Okay.
ever had a serious accident or injury?
No.
Okay. Any accident or injury involving inhaling or consuming toxic chemical agents or gases?
No.
Okay,
No.
that's great. I'm going to move on to your medications.
Okay.
Do you take any prescribed or over-the-counter medications?
I do the albuterol sulfate as
Oh,
needed,
great.
and then my birth control, which is the microgestin FE 1/20, I think it is.
Okay. How long have you been taking the birth control?
Since about 2006.
2006.
Mhm.
Okay. Any trouble or complications using the birth control?
No.
Okay, you feel pretty confident?
Oh, yeah.
Any other form of contraceptive use?
Condoms.
Condoms,
Yeah.
okay, alright. Do you take any herbal or do you do any herbal or home remedies like special teas or St. John's wort?
No.
Okay. Do you take any vitamins?
No.
And are you on a special diet that restricts certain foods?
No.
Okay. And then other than medications or home remedies, do you use any practices like prayer or meditation?
Prayer.
Prayer. And does that help you cope with stress? Is that okay? All right, I'm going to move on to your family now.
Okay.
I'm going to read a list of some common diseases and illnesses.
Okay.
Just keep in mind your parents, grandparents, or siblings, if any of these ring a bell. Allergies, asthma, high blood pressure, heart disease, stroke, diabetes, cancer, thyroid diseases, blood disorders, obesity, hearing or vision problems, birth disorders, neural problems like seizures, emotional or mental problems, or drug or alcohol use.
Okay.
So I'll start with your parents. Are they both living?
Yes, they are.
Okay. What age are they?
My mom is 66 and my dad is 64.
Okay. Do they have any problems I listed?
They both have high blood pressure.
Okay. And then how about your dad's parents? We'll start with his mom.
I don't know. She's dead, so I don't really know any too much.
Okay. About what age did she die?
She's in her 80s.
Okay. And then your dad's dad?
He passed when I was really young from a gunshot wound, so I never knew him. I don't know what age it was either. It was before I was born.
Okay. And you know about how old he was?
Mm-hmm.
And then how about your mom's mom?
She passed in a car accident in 2004.
And how old was she?
She was in her 70s.
Okay, and then how about your dad's dad? I mean, your mom's dad.
He passed from colon cancer before I was born, so I think in like the 80s.
Okay.
Mm-hmm.
Do you know if he ever went through chemo or radiation
I don't
for
think
that?
he did, no.
Okay. All right. Do you have any siblings?
I have an older brother.
Does he have any illnesses?
He's just got a mental health issues, depression.
Depression. Does he take any medication
He
for
does,
that?
yes.
Oh, do you know what he takes?
No, I don't.
Okay, no
Sorry.
problem. And how about any aunts or uncles? Do you have any?
I do. I have 2 uncles.
On your
On my mom's side, yeah.
Any problems?
Not that I know of, no.
Okay. Any significant disease or conditions for distant relatives, like cousins or any other distant relatives?
One cousin has fibroids, but
Okay.
that's all I know of.
Okay. And then are you concerned about any illnesses of a family nature?
No.
Okay.
No.
All right.
We're pretty healthy.
That's good. I'm going to go on to your home life.
Okay.
Can you please describe your living situation, or like who do you live with? Do you feel safe?
Yeah.
Okay.
I live with my parents and my brother.
Okay.
I feel safe. I have my own little space. So.
Okay. And no stress there. You feel comfortable
No.
at home. Okay. And what is your occupation?
I'm a social worker.
So okay. And what type of environment do you work in? Do you work in inpatient or?
I'm out visiting, doing home visits in clients' homes, so
Okay.
outpatient.
Do you feel safe doing that?
Mm-hmm.
Okay.
Yeah.
No violence ever occurred, or are you
No.
at high risk for violence?
I work with seniors, so no.
Seniors? Okay. Do you ever feel overworked or stressed?
Not really, no.
Okay. Have you ever had other jobs in the past where you've been overworked, stressed, or any violence?
No.
Okay, great. Moving on to your economic status.
Okay.
So what's your perception of your ability to care for yourself financially or healthcare coverage?
I think I'm
Pretty
doing
okay.
pretty okay, yeah.
That's good. And you're a social worker, so what was your highest level of education?
I have a master's in social work.
Okay, great. Have you completed any vocational or trade studies?
No.
Okay. I'm going to move on to your habits. Do you drink alcohol?
I do.
Okay, about how much?
Probably 1 to 2 times a week socially or with a meal.
Okay, do you feel you have any problem with addiction?
No.
Okay. Do you smoke or chew tobacco?
No.
Okay. Do you drink coffee?
I drink tea, not coffee. Sometimes coffee, but usually tea.
Okay. And then do you drink soda?
No.
Or anything? Okay. Do you use any illicit or recreational drugs?
No.
Okay. And have you ever used them before?
No.
Okay. Moving on to your sleep patterns, how would you describe your sleep?
I get 6 to 7 hours a night. I think that's pretty good.
Okay. Any disruptions in sleep?
No.
Okay. No disturbances. You get 6 to 7 hours. You have any concerns about sleeping? Okay. Do you exercise?
Yes.
Okay. How would you characterize your exercise? What do you do?
I get on a treadmill and run and walk and alternate between the two usually.
Okay. About every day or a couple times a week?
A couple times a week.
Okay. And for about how long?
About 30 to 45 minutes.
Okay. And moving on to your dietary practices, can you describe your dietary lifestyle? We'll just go off the past 24 hours, so it's about 7 o'clock at night now. So what did you have for dinner yesterday and then breakfast and lunch today?
Last night for dinner I had a chicken sandwich and beans and rice, and then for breakfast I had a bagel and water, and then for lunch I had a tuna sandwich, some chips, a little cup of fruit, and more water.
Okay, so that sounds pretty well balanced. Good mixture of all the food groups. Do you usually keep with that same type of balance?
Pretty much, yeah.
Okay, that's great. And you don't drink soda, you drink water. And how much water do you think?
My mug is about a 32 ounce for sure, so I get at least through one and maybe a half of another one.
Yeah. All right. Oh, and how often would you say you eat out at a restaurant per week?
Probably 2 to 3 times, maybe.
Okay. Moving on to coping and stress management. As far as stress, how would you characterize your stress in your life? Light, moderate, heavy?
Light.
Light,
Yeah.
okay. Is it mostly from work?
Yeah, probably.
Okay. So what do you do to cope with stress?
I'll talk to a friend, I'll go out, read a book.
Okay,
you know.
so it really doesn't impact your
No.
life.
Oh, gosh,
okay,
no.
your function. Okay.
Yeah.
And have you ever had to seek outside help for stress?
No.
Okay. No mental health counselor?
No.
All right. Have you or anyone in your family witnessed or been exposed to abuse or violence?
No.
Okay. Moving along to your safety practices. When you're driving, do you wear a seatbelt?
Yes, I do.
Okay. Do you bike or skateboard or anything?
No.
Okay. Do you have functioning smoke detectors, carbon monoxide detectors in your home?
Definitely.
Okay. And then in your community, either at home or work or school, have you been exposed to any health hazards? That would be things like pollution, violence, lead, radon, secondhand smoke.
No.
Okay. And you live in Richmond Park, Illinois, which is the south suburb of Chicago.
Yep.
So is your water source Lake Michigan?
Yes.
Okay. Do you have any specific religion affiliation?
Not really, no.
Okay. And anything related to your faith that would affect your health care?
No.
Okay. So now I'm going to do a review of your physical symptoms. It's just going to go from head to toe, just your whole body. Let me start with, have you now or in the past had fevers, chills, feelings of extreme tiredness, or night sweats?
No.
Okay. Have you lost any weight without trying? And have you gained any significant amount of weight in a short time?
No.
Okay. Your overall pain on a scale from 0 to being no pain, 10 being the worst pain you've ever felt, how would you describe your pain now and generally?
0.
0? Great. Moving on to your skin, have you noticed any changes in your skin?
No.
Any moles,
No.
dryness?
No.
Okay. Any changes to your nail bed? Any dryness or breaking off?
Not that I've noticed, no.
Okay. And your hair, how's your hair? Any changes?
No.
Any thinning or hair loss or
It's thickening.
thickening? That's good.
It's thickening.
And no brittleness or dryness?
No.
Okay. Your eyes, do you wear glasses or contacts?
I wear contacts.
Okay. How long have you worn contacts?
Since 5th grade.
5th grade.
Yeah.
Any trouble with your
no.
contacts? Okay. And how often? Well, when was your last eye exam?
It's probably March. Yeah.
Okay. And how often do you have an eye exam?
Once a year.
Okay. Any glaucoma or cataracts?
No.
Okay. And your ears. Have you had any hearing loss, pain, or discharge from your ears?
No.
Okay. Have you been dizzy or had any loss of balance?
No.
And do you use hearing aids?
No.
Okay. Your nose. Do you get frequent colds or runny noses?
No.
Okay. Any sinus pain?
No.
Have you had any recent infections?
No.
Okay. Moving on. Oral cavity. How often do you brush your teeth?
Every day.
Every day. And how often do you floss?
Probably once or twice a week.
Okay. And when was your last dental
It
exam?
was in June.
Okay. Anything come from that? Anything remarkable?
I
Okay.
have good teeth structure.
Okay.
So I was told.
Any missing teeth
No.
or dental problems?
No.
Okay. Moving to your neck. Have you ever had stiffness or swelling in your neck?
No.
Have you noticed any lumps ever? Or any tenderness?
No.
Okay. Moving down. Have you noticed any soreness, lumps, or discharge from your breast?
No.
Or your armpits?
No.
And how often do you do self breast exams?
Once, right before my menstrual cycle starts.
Great.
So yeah, right
So
before.
once a month?
Mhm.
Okay, great. That's how you do them. And have you ever had a mammogram?
No.
And then breast cancer doesn't run in your
No,
family?
it does not.
Okay. Have you experienced any cough or shortness of breath?
No.
Do you have a history of asthma? Yes.
Yeah.
Okay. And that's pretty much well controlled with your
Yes.
rescue inhaler? Okay. Have you experienced any chest pain?
No.
And has a professional ever told you had high blood pressure or high cholesterol?
No.
Okay. Moving on to your GI. Have you been experiencing any diarrhea or constipation?
No.
How often do you have a bowel movement?
Every couple days or so.
Okay, and any blood or anything?
No.
Or what color would you?
Brown.
And not too dark.
No. Oh,
And
gosh.
do you have to strain to have one?
No.
Okay. And no bleeding, any nausea or vomiting?
Nope.
Okay. And have you noticed any swelling in the glands around your groin?
No.
Okay. Urinary symptoms. Do you feel that you urinate a lot?
No.
Okay. Any blood in your urine?
No.
Okay. Any incontinence where you can't hold it?
Mhm.
Do you have any flank pain? Pain on your sides?
No.
Okay. Have you had any infections like STIs or UTIs?
No.
Okay. And any vaginal discharge? Okay. Your reproductive history. So when was your last menstrual period?
About 3 weeks ago.
Okay. And was it a typical period for you?
Yeah.
Okay. How would you describe your typical periods?
It's usually light the first couple of days,
Mhm.
and then a little bit heavier, and then that's it.
And how many days do they last?
It's about 3 days.
3 days. And do you have cramping with?
No.
Okay. Do you get any premenstrual symptoms where you know it's coming?
Not that I noticed, no.
Okay. No cramps. Do you have children?
No.
No children. Have you ever been pregnant?
No.
And no abortions or miscarriages?
No.
Okay. Do you know if you have any fertility problems?
Not that I know of.
Okay. Do you desire to have children one day?
Eventually.
Okay.
No rush.
And you use birth control. Have you ever used any other type of contraception?
The condoms.
Condom.
Mhm.
Okay. And when was your last pap smear?
It's been about a year.
A year?
Yeah.
Okay. Was there anything abnormal about that?
No.
Okay. Moving on to your sexual history. Are you sexually active?
Yes.
All right. And when was the last time you had sex?
About June.
June. And do you have sex with men, women, or both?
Men.
And how many partners have you had?
11.
11. Do you have oral, anal, or vaginal sex, or a mixture?
Oral and vaginal.
Okay. And moving on to your muscles. Have you noticed any limitations in your range of motion in your arms or legs or neck?
Nope.
Okay. Do you have any pain or stiffness in your joints?
No.
Do you have an unsteady walk?
No.
Okay. Moving on to your neurological system, your nervous system. Any history of head injuries? Have you ever had a loss of consciousness?
No.
Okay. Any loss of coordination or dizziness ever?
No.
Okay. Any numbness or tingling or seizures?
No.
Okay. And do you experience any headaches?
No.
Good. And any impaired thought process or memory loss or memory judgment? Okay. And are you irritable or experience mood swings?
No.
Okay. And we're almost wrapping up. Thank you for being so patient. Any anemia in your history, like low blood levels, low iron levels?
No.
All right. Have you ever had a blood transfusion or platelet transfusion?
Nope.
And no thyroid problems like you said earlier? Any sensitivity to hot or cold environments?
Not that I noticed.
Okay. And you said no, you don't have frequent or extreme urination?
Nope.
Okay. And any extreme thirst or hunger?
No.
Okay, great. Last section is your mental status. How would you describe your usual mood? Like generally happy or indifferent?
Generally happy.
Okay, good. No mood swings?
Not that I know of.
Okay. Any anxiety or panic attacks?
No.
All right. Any depression?
No.
And any hallucinations, either visual or hearing hallucinations? Okay. Have you ever attempted suicide?
No.
Okay. Or have you ever thought about it?
No.
Okay. Any eating disorders?
No.
Okay. That's about it. Thank you. Is there anything else about your health that you were concerned about that we should know about?
No. Sorry, I'm so boring.
No, you're fine. Thank you, Ms.
Thank you,
Hearns.
Ms.
Nice
Lisa.
to meet you.